चल रहा है लाइव है वापस रीलोड करो हाँ आई थिंक we're live. Okay, hi. We're just waiting for our doctor to join in. Thank you so much for joining in this evening. We will be starting the webinar in about 2 to 3 minutes. Today's topic is something that was highly demanded after our first webinar on the same topic, which is modern treatments for arthritis. This is going to be a very comprehensive webinar. We'll not just be talking about modern treatments, but also a little bit about what is arthritis and how does it impact people on their day-to-day lives. Maybe this is a platform where you'll be able to find other people and the doctor talk about things that you have might suffered through. So if you could just wait for 5 minutes and we'll be starting soon. Oh. We would love to hear from you in the chat if you are also someone that is suffering from arthritis or are confused about what the pain is, if you need any clarity about surgery. Are you contemplating surgery or are you attending this webinar for a loved one? I know my mother also has early onset arthritis because it comes from my grandmother. So I have seen how it can impact day-to-day life, and that's why I think this webinar is a very good initiative to get some clarity around all the fear and confusion when it comes to arthritis. I know that it's not just something that can be attributed to just age. I know there are a lot of factors that may play a role to it, and very excited again to speak with Dr. Akshay and get more clarity like last time. Hello, hi everybody. Thank you for dropping in your greetings. We'll be starting in another few minutes, and thank you for joining us on a weekday evening. We know how tiring it can get, but we thought it would be the best time to connect with everybody. Just a reminder, after this webinar, after we discuss the main contents of the webinar, we do have about 15 to 20 minutes of a live Q&A. So please have your questions ready. Dr. Akshay will be right here and he'll be answering all your questions. If you have any confusion or need any clarity, we will also be dropping a custom link through which you can book a free appointment with Dr. Akshay. The link you'll find in the description of this video and also in the WhatsApp group you're already part of. So nice to see so many people joining us. I'm sure everyone has good questions to ask and add value to our conversation. Um, we hope we were able to encapsulate the struggles of arthritis on the group. I know we set up some polls because we wanted to know what people are struggling with. Hello, hi everybody, good evening. We'll just be starting in another 2 to 3 minutes. Please keep your questions ready. Please be active, and we're looking forward to having a great conversation. Bye. Hmm. Hmm. But कुछ नहीं होता, वो मैंने साइजिंग कर दी थी, ठीक बैठ रही थी वो, कुछ नहीं होता ऐसे, इट्स ओके, अब मैं मैस नहीं करने जा रही, इट्स ओके. Just to give you a rundown of what we will be discussing today, there are a lot of modern treatments that have come up when it comes to arthritis. I know there's a big fear around getting a full on knee replacement surgery, and a lot of people think that's their only option. However, we saw this increasing need to address these concerns because we do know there are a lot of other treatment options available that have been very helpful. Obviously it depends from case to case basis, and your doctor is the best person to consult you, but we thought it was important to have the discussion to clear the air. And obviously I think a knee replacement surgery is something that scares everybody, so just to acknowledge that fear and present other options available, and just to get clarity on what should be your next step. To go over what we would talk about today is, I'm sure we've heard of PRP, stem cells, radio frequency treatments. There's also hyaluronic acid and gel injections that have been helpful to a lot of patients. Obviously, Dr. Akshay will come and, tell you way more about it than I can. And he's just going to be joining us in another 2 minutes. Hi, Saurav. Thank you so much for your question. Please join us and stick through the webinar. We have a live Q&A session after we are done discussing all our major topics. We will definitely give about 15 to 20 minutes to discuss all of your questions. So please keep sending them in the chat, and don't worry, we'll acknowledge them all. We will also be touching upon a few lifestyle related questions. There's been a lot of talk about how people that might be overweight, are they at a higher risk of getting arthritis? How does arthritis affect them? So we will definitely be acknowledging those questions as well. And I do think this becomes a bigger conversation topic as people age. So alongside that, we will also be talking about physiotherapy and weight management, like I mentioned, alongside the modern treatment plans that I've just mentioned. So it's going to be a very comprehensive discussion. Okay, great. Hi, Dr. Akshay, can you hear us?
Hello.
Hello, hi.
I am so sorry. So sorry. Just surgery ran late.
No worries. We're happy to have you on board. We already have Quite a few people joining us, and we're very excited to start.
Oh,
So, thank you for making
well,
time.
I really apologize to everyone,
No worries, no
and
worries.
thank you all for taking the time to join us.
Okay, great. I think without any further ado, we'll start our conversation. Good evening to Dr. Akshay and everybody on our webinar. We know that knee pain is not just an age thing, and it affects millions of people, and it sneaks into our daily lives, and we struggle with stairs, miss a morning walk. I mean, there are a lot of things that go behind it. So I know there's good news for us at the end of the webinar. There are a lot of modern treatments available and a lot of options that people can consider. So this is a conversation regarding that. Thank you for being here and helping us out. I want to start talk about how do we understand our knee pain. Please tell me, Dr. Akshay, why is it important even to talk about knee pain and treatment options early?
All right. So, Sanya, we always, India has been the home of Ayurveda and India has been the home of homeopathy also. And we have always believed in one thing: prevention is better than cure. So, if you know why what is happening, you can actually prevent it rather than, spending thousands and thousands of rupees on treatments, which eventually then that is number one. Number two is it's always better to prevent knee pain because there are certain conditions such as arthritis which become non-reversible. So once they start, essentially what happens is you can manage them, you can control them, but you cannot reverse them. So our idea is always that rather than starting a treatment which it helps to manage you, do something which actually prevents it or prolongs your knee's life as much as possible till you actually start developing an age-related problem.
Okay, so is this holy grail advice for anything orthopedics related, anything bone related?
Yeah, I mean, this is for, in fact, I would say this should be the advice for life. It's prevention is always better than cure. In orthopedics, especially, see, bones, muscles, they take a long time to recover. Now, I always tell my patients this that, your an appendix surgery or a gallbladder surgery is very, very easy. You can have an ice cream after that. You can go for a run because these are soft tissue issues. The issue with bones and muscles is that they are the weight bearers of your body, right? So if they are the ones that are on maximum load, whether you're sitting, standing, working on a laptop, going for a run. So whenever you have an injury or an issue in these issues, in conditions, then these things can become, the recovery takes longer. And not only does it take longer physically, it also affects you mentally because now, we're very active, we want to be active. But when you start recovering from a muscle injury, not only does it affect your day-to-day living, but it also starts affecting you mentally in the way that you start getting frustrated that why am I not recovering? Why am I not becoming normal? And what I want to say to the viewers is that musculoskeletal injuries are a special type of injuries, and why we have come up with the whole idea of a sports medicine, specialty or a joint specialty is because they require that amount of time to kind of and that amount of specialization to understand because every condition is different, the treatment is different, and it's more long term than probably a general other issues like an eye issue or a nose issue. So at the end of the day, the dictum should always be prevent it, rather than trying to cure it.
Okay, I think that makes a lot of sense, and this helps me segue into our next question. Please tell me, for the audience's clarity and mind too, what is knee arthritis and why does it cause pain? Let's go back to the basics.
Right. So knee arthritis, unless you're talking about blood-related arthritis such as rheumatoid or psoriatic, knee arthritis, which is also called as osteoarthritis, is a degenerative disease which usually happens, most commonly happens because of age. As you age, your body starts to degenerate. And secondarily happens because of trauma that you might have had some fracture or some sort of injury when you were young. You've ignored it, you've pushed it, and then slowly and steadily it starts appearing. So what it actually is a degeneration of the cartilage. So what is the cartilage? Now, if you see your knee joint is not only made up of bones. It is made up of certain ligaments, which give you stability. It is made up of certain cushions, which are known as menisci, and it is made up of the cartilage. And each structure has its own functional role. So the cartilage is what gives that joint fluid or the grease of the engine, which allows the knee to move in a very smooth manner. The menisci is what prevents the two bones from touching each other, and the ligament is what gives it stability. If all three work well, the knee is healthy. But when your menisci is injured or your ligament is injured or directly your cartilage is injured, eventually all of this leads to a cartilage degeneration or age leads to a cartilage degeneration. So when this cartilage or this layer which forms the grease of the joint start getting degenerated or thinned out, then your bones start touching each other. When your bones start touching each other, essentially it is a hard surface rubbing on a hard surface. When a hard surface rubs on a hard surface, it starts to create friction, which automatically then you enter into a cycle, which is what we call as a vicious cycle, where everything now starts getting into a loop and you're not able to get out of the loop, right? So if I was to summarize in the layman's term, a knee arthritis is a degeneration of the lining of the bones, which eventually causes rubbing of the bones and finally causes crackling sounds, pain because of all of these issues,
Okay.
eventually which leads to a point where you may require a surgery.
Okay, so thank you for that clarity. So I know there's an entire system around how knee works healthily, but you've mentioned how it works. Then when is a good time for someone to see a doctor? When do they need to come see you?
Right. Right. So mild amount of pain, mild amount of stiffness, which goes away on its own, or after a run, is absolutely normal. But if you have pain with every step you walk, if you are having sounds coming from your knees along with pain, if you have swelling along with pain, or if your pain is worsening, or if your way of walking has started to change, these are what we call as red flag signs. And these signs are very important because these signs mean there is some sort of pathology which is happening in your knee and you need to get it checked out before it's too late.
Okay. So when your knee is swelling up and there's prolonged stiffness and pain and it's only worsening, that's a good time to come see a doctor.
Correct.
Okay, so I think we've covered the basics. Now I'm also curious. I'm sure you have a lot of patients that come to you and have a lot of things to say that might not always be true. So what are some myths around arthritis that you have heard from your patients that have raised alarms?
Wow, that's an interesting question. Yeah, I mean, I've heard a lot of bizarre things, honestly, but I think the most common things that we hear is that one is that knee arthritis, once it sets in, it can be reversed, where it has very easily been proven that I have a lot of patients come in who say that if I take Herbalife or Ayurveda, I'll reverse my arthritis. I'm very confident about it, which is a myth. Please don't believe it. Stage one can be reversed through certain injections and certain medicines. I'm not denying that. But stage two, three, and four onwards, it has to be managed well. The second myth is that knee arthritis happens because you eat something which is not supposed to be eaten.
Okay.
Again, a myth. Knee arthritis usually happens because of age-related problem or a trauma to your knee. It has very rarely to do something with what you eat unless you eat fried food 24 hours a day, 365 days a week, 3 times a day.
Yeah.
Right? And the last myth I've probably heard, which is a little rarer as compared to the other two, but I've heard is that I remember this patient who had asked me a very fascinating question. I'm not remembering it, but if when I remember it, I'll get back to you about that. But it was a very fascinating myth, and subsequently, I had a couple of other patients. Oh yeah, if you live in cold countries, then you end up having arthritis more. So that is not true. In cold places, you do feel pain a little bit more because your joint becomes stiffer. But cold places have nothing to do with arthritis. These are two different entities.
I think, thank you for letting us know. I think this was an important question to ask because I'm sure a lot of people have any preconceived notions, and it's important that we bust those here. So we've spoken about arthritis, we've spoken about myths. We've also, before you joined us, I was talking about the much feared total knee replacement surgery. So I'm sure a lot of people are here to talk about what are some non-surgical treatments, like you mentioned injections as well. So I know I've heard of PRP, stem cells, there's a lot of stuff out there. Could you help clear the air?
Yeah. So whenever we talk about non-surgical treatments, whenever we talk about treatment in general, we talk about first being conservative management, such as physiotherapy, exercises, supplements. Now, physiotherapy and exercises are very important because when you do physiotherapy and exercises, your muscles become stronger and they help take the weight of the bones, which is called offloading. It also, the strength of the muscle also helps you increase the movement of your joint, which leads to joint lubrication, which again helps you recover from early stage of arthritis. There are certain supplements such as collagen supplements, and there's been a lot of debate about these in the recent past. But let me tell you, collagen supplements do work, provided that you do physiotherapy as well, right? Now, these are the conservative managements, and along with that, there are certain taping techniques, there are certain massage techniques, there are certain needling and cupping techniques, which unfortunately have been proven not to be very effective. However, having said that, For some patients, they do work, but initial stages of arthritis. When we talk about stage 2 and 3, which is the mid stage of arthritis, then there are certain injections which have recently come into the market. One is a PRP, one is a stem cell, one is a GFC, one is a BMAC. Now, let me tell you this, they all come into the globe of stem cell. They are just different components which are taken from different parts of your body. So, a GFC is taken from your blood, but it has a different method of extraction. A PRP is also taken from your blood, but the method of extraction is different. A stem cell or a BMAC is taken from your bone marrow. Nowadays, we even have adipose stem cell, where the stem cell is taken from your fat. The whole idea of a stem cell is that now we all know our blood has healing capacity. If you get injured, it heals on its own. Usually a skin injury heals on its own. So what we essentially do in all of these things is we take those stem cells, we take that blood or wherever we take the stem cells from, and we process it in a specific manner, which is scientifically proven. And we only take the positive healing factors from that and we push it into your joint, right? So what that happens is when it pushes into the joint, whatever area is damaged, whether it's the meniscus or the ligament or the cartilage, it tries to heal it up in a natural manner. So it's like saying that you send a carpenter to a broken house and he looks at the house and he says, okay, whatever I can fix, I'll fix.
Okay.
Right?
Okay.
So these are some of the treatments which work. Now, there are other injections known as viscosupplements, which help in, forming the layer or the lining of the knee joint. And those help in a different manner. They don't regenerate your cartilage as such, but they give you that gap or that, that joint fluid in your joint so that, for some temporary times you can recover. But let me tell you this, viscosupplementation in itself over the past couple of years has been proven to be not very effective. So now what we've started doing is we've started combining PRP and viscosupplementation.
Okay.
Which means we give you that initial joint push, right? And also we give you that PRP so that both work in tandem and prevent you from reaching a stage where you might require a knee replacement surgery. Now, when it comes to stage 4, that's when it gets tricky. See, in a stage 4, essentially what it means is your cartilage is completely damaged, right? There is nothing present that the stem cell can give it inside it, right? So that it can regenerate from, right? So that is why in a stage 4 arthritis, we always tell our patients, you can try the stem cells, you can try this viscosupplementation, but it's not a permanent cure. However, the permanent cure becomes a total knee replacement. However, I have had, in the past 6-8 months, I've had patients with me who, despite being grade 4, have taken viscosupplementation and PRP, been very, very focused on their physiotherapy. And now, even though their x-rays look quite bad, they themselves are symptomatically much, much better, to a point where they have said, Doc, I don't think I need a knee replacement right now. Let's postpone it.
Okay. Okay, so that sounds like great positive news for our viewers. Just to clarify, because I think I need clarification on this, I'm sure the audience does as well. Is arthritis here being caused by damage to the cartilage, or is it the other aspects of the systems you mentioned as well?
Essentially, arthritis means your cartilage gets damaged. Okay. Now, is it because your meniscus or a cushion is not functioning, which is why the cartilage rubbed and got damaged? Is it because you had a knee ligament tear, which is why the knee became unstable, so it rubbed and got damaged? Or is it because there was a direct damage?
Okay.
But essentially, knee arthritis is a cartilage damage, a loss of cartilage, which eventually fails to produce the joint fluid, which makes your joint dry. You hear crackling sounds. You see your bones starting to bend. You see your walking pattern starting to change. Eventually, then what starts happening is your back starts getting overloaded, your shoulders start getting overloaded, your ankle starts to swell, essentially because your knee is not able to function in a normal manner. And that leads to a lot of other things, And also, I'd like to mention this, Sana, that a lot of people talk about the physicality of arthritis. But let me tell you this, mentally, it also has a huge bearing on a lot of patients, especially people who have been physically active, but suddenly find themselves, struggling with pain. Second part of arthritis is it is quite prominent when, especially in grade 4, there is night pain. So when you're not able to sleep, not only can you not recover, but also you start getting irritable, your recovery. So arthritis, unfortunately, is something which people need to understand, that it not only affects you physically, but it also has mental afflictions. So if you're able to recognize those inflictions, then you start realizing, yes, this might be the time that I may need to doctor.
Definitely. So you mentioned a bunch of, treatment options. I'm curious, just to reiterate, so there are some that are relevant for stage 2 and 3. However, stage 4 usually requires a replacement surgery, but as you've seen in the recent times, other options have also been helpful. So just to set clarity within our audience that you do have
Right.
options available. It's not always all that scary. I do want to understand what level of pain relief can patients expect. Say if they are taking
Uh,
this stem cell, modern treatment that you're
Correct.
talking about.
So I forgot to mention this. Thanks for reminding me. There is another procedure that we do, which is known as radio frequency ablation.
Hmm.
Right now, radio frequency ablation for us has been a game changer, especially for people who are not. It was introduced initially for people who are not candidates for knee replacement,
Hmm.
such as people with heart diseases, people who are not fit for surgery, or people with a single kidney, and so on and so forth. But what we've started realizing is even in grade 2 and grade 3 arthritis, if we combine this radio frequency ablation with your PRPs and stem cells, then your pain reduces from probably say a 10 out of 10 to probably a 2 out of 10 or a 1 out of 10.
Hmm.
Right? And what radio frequency ablation is now, let me give you this example. Now you switch on a light switch here, and the bulb over there switches on. So, which means there is a connection between that. Similarly, in a human body, there is a connection between your knee and your brain through the nerve. And this is known as a sensory nerve. The whole idea of this nerve is to take the sensation of pain from your knee to your brain and tell you that there is pain. So essentially, what we do is we ablate those nerves, or we burn off those nerves. So we don't cause you any lasting physical trauma. We don't affect your muscles, but it burns up those nerves. The signal to the brain that the pain is there doesn't go.
Okay.
When that signal doesn't go, you mentally become more confident to be able to exercises and do your normal activity. Now, let me tell you this. Does it solve the underlying problem? No. So what will solve the underlying problem will be the stem cell. What the radio frequency will do is get rid of your pain or decrease your pain significantly so that you become mentally more confident. You can do your physiotherapy exercises without feeling too much pain, and that helps you recover. Now, radio frequency ablation is not a permanent solution. What it has been shown in literature is that the nerves may regenerate after 6 months to 2 years. And it's a huge gap because this is a recent, in the last 5-7 years, this has been introduced, and a lot of research is still happening. But the short-term results of radiofrequency ablation with PRP have been fantastic.
Okay, I think so. Your talk about how it impacts one's mental health as well is so relevant here if you're talking about this treatment, and how, because of this treatment, people are able to continue having faith and continuing their routines as they should, is really helpful. So, you talked about pain relief through radio frequency, but also pain relief through stem cell treatments and others. How does that look like?
So it's very simple. If the cause that is causing you the problem is sorted, then your pain also gets sorted.
Okay.
Right? So if there is, again, as an analogy, if somebody who's there keeps punching you, you'll keep having pain. But if you remove the guy who's punching you, you won't have pain. So when you remove the problem which is there through stem cells and RFA and physiotherapy, essentially your pain comes down because you've tackled the problem. Excuse me, just 1 second. Then I've just 1 second. Yeah, please come in.
Right. Okay, I think we have had very interesting conversation with Dr. Akshay. We are going to continue. We have a few very interesting questions about weight management, physiotherapy, and also about what to choose next, depending on the stage of arthritis you're at and your pain level. So please stay tuned. A reminder also is that we will be dropping in a custom link through which you can book a free appointment with Dr. Akshay. That link will be in this video's description, as well as on the WhatsApp group you're a part of. We will also be having a live Q&A session, so please stick around for that. Up until now, I think we've talked about what arthritis is, how it's impacting patients, and what are some modern treatments available. Dr. Akshay mentioned stem cells and the various ways through that can help, make pain better. He also mentioned radio frequency treatments, which will help, like I said, like from a 10 to a 2 pain level, which sounds like a very positive news for people that are really afraid of total knee replacement surgery, and also positive news for potential treatments that can be not as invasive but still help. please keep sending in your questions. I am seeing a few questions here, and we will definitely be asking those. I think what was very interesting was the various definitions of the stages that Dr. Akshay mentioned. That each stage will have a different treatment plan, and I think that's very important to know because I feel like as and when patients get a diagnosis of arthritis, their fear is that they need to go for surgery. But it's very reassuring to hear that there are other things that we can do to feel better and maybe help the pain. We are just waiting for doctor to join us. Please stay tuned. We're getting very great, interesting questions. Someone is asking the success of stem cell treatment. I think this is a very interesting question. I'm sure a lot of people in the audience would want to know the answer to it. So please stick around for the live Q&A.
Right. So sorry, doctor's life. So
No
just had a
worries.
patient with few doubts. I'm so sorry. Like I said.
No worries. Let's dig right into the next question. I
Sure.
want to know what is the typical downtime after, say, these treatments?
Uh, right. So the beauty of these treatments is that you can actually start your normal. You don't have to wait and watch and rest after these injections. You can walk home essentially.
Oh,
And then you do, yeah, you can walk home. And these are 10-minute procedures, 15-minute procedures, not more than that. These are done under local anesthesia many of the times. Even radio frequency ablation is just done under short general anesthesia,
okay.
where you don't have to put a tube or anything. We just give you a small sedative.
Hmm.
You sleep, we do the procedure, and we send you home.
Hmm.
The beauty, again, like I said, is these many of these are now covered in insurance, so you can do it. The downtime of recovery, see, Sanya, this is a tricky question in the sense that healing is a different capacity for everyone else. See, today you get injured, I get injured. Does it heal at the same time? No. So every person's healing capacity is different. But what we usually say is an RFA with a radio frequency with a PRP or a stem cell, within a week to 10 days, you start seeing the effects. Around 40-45 days, the effects peak and then they just keep moving from there.
Oh, okay. Okay, that's very reassuring to hear. I also want, I think when we met, you had spoken about BMAC, and there is, you know,
Yes. Right. Yes. Thanks for that. So recently, this technique has been there in the market for a long time, where we used to put a small needle in the bone marrow. You would take out your bone marrow, and bone marrow transplant is something that a lot of people have heard, which was there usually used for leukemia and blood cancers. But over the last couple of years, there's been a lot of good research which has come in, which has said that a BMAC or a bone marrow aspiration and preparing it in a certain manner and injecting it in your knee is a much better solution than a PRP because it gives you more the number of healing factors than a PRP can give. Sometimes, in some cases, even 100 times more.
hmm, hmm,
So what we always say is that if I need to heal up to this level, and if I have 10% versus 90% of healing factors, the 90% works better.
hmm,
The chances of you not going into a knee replacement is better with a BMAC.
hmm,
So the only thing was in the last 2 years, a lot of research was going on. We were not sure. But now the research has clinically proven that BMAC is probably going to be the next thing in the future.
hmm,
And adipose tissue stem cells have also come in, which is a lot of research is going on it. It's still not verified,
hmm,
but there's a lot of positive thinking about it
hmm.
that this BMAC and adipose tissue, especially given in grade 2 and grade 3, may extend the life of the knee to such an extent that you may not require a knee replacement in your life.
Okay, wow. I think it's a good time in the evolution of treatments to have so many
Oh
treatment
yeah,
options for people
fantastic
suffering.
things are happening.
Yeah, fantastic things are happening. You've reiterated, segueing now, you've reiterated the importance of physiotherapy. But I want to ask you the role, what role is physiotherapy actually playing, and what role does weight management then also play in this equation?
See, eventually, again, conceptually speaking, the heavier you are, the more load is there on your joint. So, weight management becomes very important. Sorry, very important in the fact that your recovery does depend on your weight. If you are heavier, you will take a long time to recover. But let's think about it practically. We have somebody who's in pain, and you tell the patient you do exercise and lose weight. Does it make sense? No, right? How can you lose weight? But there's only a certain amount of weight you can lose after a certain age through diet,
Hmm.
right? So weight management, while important, becomes an adjunct to physiotherapy and PRP injections. Because what I always tell my patients is the first idea is to decrease your pain.
Hmm.
Only then will you be able to do exercises and do physiotherapy and then start. So even when a patient comes to us with conservative management, initially we always tell them we are giving you anti-inflammatories, not painkillers, anti-inflammatories to decrease your pain,
Hmm.
right? And once the pain decreases, then you depend on physiotherapy to give you long term results. We don't make you depend on painkillers or anti inflammatories for a long time because they have side effects. They don't solve the problem, they mask the pain. In fact, in my particular practice, to be very honest with you, don't give painkillers. I give supplements. So I always tell the patient if you can bear the pain, take the supplements. It'll help you heal naturally, then do the physiotherapy. So, weight management, while yes, a very, very imperative and important part, but practically speaking, you have to understand that the patient has been in pain for a long time. It's starting to affect them mentally. If I tell the same patient, you go cycle for 30 minutes, you just look at me and say, Doc, what are you saying?
Hmm.
I can't even move my knees.
Hmm.
So the idea is it's a step. It's a step in recovery, but the step is later. The first is pain management through medicines and physiotherapy. Then you go on to weight loss.
Okay. So I think it makes a lot of sense to then have a treatment plan, which is obviously customized per patient, but then kind of escalates it in the way the patient would need. You have to see each
Correct.
case as it comes, which makes me
Correct.
ask you then how should a patient then choose a treatment plan for themselves? How do they know what works, what doesn't? What should they come and ask you?
Right. So this is where our role comes in. See, I always tell that doctors are supposed to tell you what the problem is, to explain to you why it happened, how it happened, when it happened, and how it's going to go on, and give to you the treatment choices and tell you the pros and cons of the choices as per the stage that you're in. So you must understand that anything in medicine is staged. And the reason why we stage it is because we know at what stage what works.
Hmm.
Now, if I give conservative management for a grade 4 arthritis, that's not going to work.
Hmm.
If I tell knee replacement for a grade 1 arthritis, that is not going to work, right? So everything is staged. So to answer your question in a nutshell, it is our job to tell you what works. But at the end of the day, it is your job to Google it, chat GPT it, talk to people, come back to me and ask me the pertinent questions.
Hmm.
See, I'm a guy who always tells people it is your right. It is your right to ask me questions because I am the guy with the knowledge. You are the problem with the person with the problem.
Hmm.
So do meet the doctor first, have a consultation, ask the patient ask the doctor basic questions, see what he's written, go read about it, do your own research. Because usually arthritis is not an emergency. Unless you develop a stress fracture, which is very rare,
Hmm.
it's usually not an emergency. So read about it, ask the doctor your questions, and then go in and take an informed decision.
Hmm. I think this is reassuring to hear because it seems like you and the patient are collaboratively working to help the patient get better. It is not that they're coming to ask you what you should do and you're telling them and they're getting it done. I feel like when the patient feels like they're part of the care process, they feel more confident, I think, about their own recovery, which is important, I feel, the end of the day, to feel that sense of positivity that, hum honge kamyab.
Right, fantastic. Well said, yeah.
I want to ask you one last question from my end, and then we will open the forum for questions. I've heard of assistive devices and techniques that genuinely help. Are there
Yes.
any in your purview or you've prescribed to your patients that have been helpful?
Yes. So honestly, the American Academy of Orthopedics says that knee braces and assistive devices doesn't work. But in my cases, there are certain patients in a certain subset of patients where they work really well. Right now, I cannot generalize those subset of patients because I usually examine the patients and find out there are a lot of factors that go into it which are very technical. So it's a very difficult to tell you in a layman's language. There's one thing that I really can't generalize, but yes, there is definitely a role of assistive devices. It all depends on, your conversation with the patient, your examination of the patient, and your understanding of what the patient's requirements are in terms of their physical activity. If there's an active patient, for them, an assistive device works really well. For an inactive patient, usually may not. But again, having said this generalization is not true,
Okay.
because I've had both patients on both sides of the spectrum. So
Hmm.
what I say is assistive devices have a role. The role depends on a very personalized plan of talking to the patient, examining the patient, telling them, whether the assistive devices will work or not. And that comes through experience and the teaching that we have. Nowadays, especially for paralyzed patients, we are having these things like a exoskeleton,
Hmm.
where you can actually wear the skeleton and start walking. And I feel that's the future.
Hmm.
That's the future of conservative management, where in fact, we've had, I think ISRO, if I'm not mistaken, I might be wrong here, so guys don't kill me for this. But I think ISRO has come up with an exoskeleton which was tested in Ahmedabad, where a paralyzed man, paralyzed lower limb, walked for the first time in 3 years just by holding the levers. And that's groundbreaking,
Hmm.
right?
Definitely.
So I do feel that yes, and it has come for paralysis because that's the need of the hour for them. But I do feel that even in arthritic patients, there will be certain assistive devices which will help offload those knees, right? So that a patient can walk better than what they're walking now, and through probably a lot of research over years, may not require a knee replacement.
Hmm. So, assistive devices again are a very personal patient to patient basis. So, positive, negative, neutral would depend on the patient.
Absolutely.
Okay, I think we've had a great insightful discussion. Now we're opening the forum to questions that are coming in. We have quite a few. We have
Oh,
someone asking us, what is the success rate of stem cell treatment? We've
right.
read that stem cells could get misdirected and some other part shows abnormality. Is this true?
All right. So the success rate of stem cell depends on the grade in which you give. In grade 4, the success rate of stem cell has been known to be 10 to 15%. In grade 2 and 3, it's about 50 to 70%. And in grade 1, you usually don't need stem cells. What kind of stem cell? Like I said, PRPs have worked fairly well, but BMAC and adipose is now probably going to be the next thing in the future. And when it comes to giving it to a different part, see, you see, the knee is a single compartment. So unless you really, really badly mess up, or you're not experienced in the knee, you never really give a stem cell, unless and until, I mean, it never goes to any other part of the body. Similarly, in the ankle, when it comes to the shoulder joint, usually what we say is the stem cell is given under ultrasound guidance.
Hmm.
Now, a lot of doctors are promoting ultrasound guidance of the knee. But let me be very clear to you: if you read about the knee joint, ultrasound guidance in the knee usually is not required unless there's a grade for arthritis, but there's no space,
Hmm.
and then you see it under ultrasound and give it. But however, the whole point becomes moot, because in a grade 4, it's not supposed to be given.
Hmm. Hmm.
Right. So if you were to ask me to summarize this question, can it go to some other part of the joint? Well, in my practice, touchwood, till now, it never has. And I've never heard a patient where it's happened. So either there's been a gross error that has happened while giving the procedure, or something else which I'm not very familiar with.
Hmm.
Usually, in the knee, in the ankle, even in the elbow, blind procedures are fine. In the shoulder, and probably I would say, the hip is where you need an ultrasound or a CM.
Hmm. Okay, makes sense. I think we'll go to the next question as well. I think it is a repetition, but I think it's important for us to cover it again. They're
Yeah.
asking, will stem cell treatment work for stage 4 arthritis? We've already
So,
spoken about it, but I think we can reiterate again for the audience.
so radio frequency ablation with stem cell is something that we have been trying for grade 4 arthritis, but again with a guarded prognosis, where we tell the patient, if it works, fantastic. If it doesn't work, then the only treatment left is total knee replacement.
Hmm.
However, I always tell my patients this: there comes a time in your life when you are in so much pain that something has to be done.
Hmm.
Trying something with a guarded prognosis with a full understanding is always better than not doing anything.
Hmm.
Because not doing anything or inaction means eventually you're going to land up in a knee replacement.
Hmm.
However, we've had patients where we've given radiofrequency ablation, and touchwood, I think it's been about a year, they're pretty much normal. Yes, their legs are bent. Yes, that they still have arthritis, but they're walking pain free,
Hmm.
which is a great achievement for them.
Okay, sounds good. We have another interesting question coming up. Does varicose veins affect knee pain arthritis?
Varicose veins does cause knee pain and below knee pain, and but it has nothing to do with arthritis. The problem that happens is varicose veins is usually found in people with arthritis.
Okay.
So it's very difficult to differentiate which pain is what. Many times you go to a doctor and they say, no, you have arthritis. The doctor would say, no, you have varicose veins. So it's a very simple thing. A varicose vein has usually a pulling or a tugging sort of a pain. Whereas an arthritic pain is like a pain which is coming from inside the bone. It is associated with crackling. You cannot walk, right? And it is quite sharp at times, right? So the way to differentiate it is it's very simple. You get an ultrasound and an X-ray. An X-ray tells you what is the stage of arthritis. An ultrasound tells you what is the stage of varicosity. Whichever stage is higher is the one that is actually affecting you more.
Okay. Okay. I think it clears this question up definitely. We have a question coming in for treatments like PRP, GSE, BMEC. Can a patient take them more than once and still expect good results?
Yeah. So usually PRP treatments and GFCs are given one injection a month for 3 months. A single injection usually doesn't work.
Okay.
Right. So, and of course, these are you can take it every year if it's worked for you. So definitely there's no side effect to that because it's essentially your own blood.
Okay. Yes, definitely. Another interesting question is, will these treatments stop arthritis from progressing or just help manage the pain?
That's what I said. Arthritis, once it starts and goes to grade 2 and grade 3, cannot be reversed. Can it be managed? Yes. Can it be stopped? Not really. But managing in a way through physiotherapy, through stem cells, pushing you to a point where you don't need a knee replacement is, where our goal lies. So not every arthritic knee needs a knee replacement. Not every non-arthritic knee can do without a knee replacement. It all depends on the patient's symptomology. If a patient is fine, yeah, I'll call you. Okay. Thanks. No, carry on. I'll wait. You wait? Okay, I'll see. So not every arthritic knee, needs a knee replacement. So what I said is that the patient, see, at the end of the day, you're treating a patient, you're not treating an X-ray. So I've had patients who have needed a knee replacement, like I said, didn't require it because RFA and PRP worked, right? And I've had patients who the X-ray looks great, but when you get the MRI done, there's grade 4 cartilage damage, there's a lot of issues. And they required a knee replacement and they're doing really well. So at the end of the day, the doctor has to decide whether you're treating the patient the X-ray, and I treat patients. So what I always tell people is, that's why do your research, find out, see, try the treatments that are there, if you're in the grade 2, grade 3 section, so that at least you've done something about it. And if it works for you, that's fantastic. But ask your doctor questions about those things because those are important for you.
So I think asking good questions is also really important for the patient.
And you should do your research. Absolutely. I mean, I'm a guy who always tells my patients, please Google ChatGPT and come back and tell me what are the list of questions and answer it. I'd be more than happy to. We've been studying for more than 18 years, 20 years, practicing for 10 plus years. This is what we do.
Definitely. So the answer to this question would be, it would not stop progressing it, but would help manage symptoms.
Absolutely.
Okay, we have another question coming in. I'm facing hip osteoarthritis, which is 4th stage. Can you please suggest alternatives without surgery?
You see, recently in the recent past, we've done a hip arthroscopy where we put a camera in, we've cleared up the joint, we've removed all the the damaged tissue, and we put a PRP or a BMAC through the hip bone to allow it to heal. Now, I must say that this particular treatment, as of now, with the current technology, has given that particular patient, a few patients, 6 months to 7 months of a good life. But unfortunately, when it comes to a grade 4, whether it's a knee or a hip, the long-term permanent solution does become a hip replacement. However, let me point this out to you. A hip replacement is a much, much, much more rewarding surgery than a knee replacement. In fact, I have a patient whose video, I'll share it with you, who's started running after 12 days of doing hip replacement of both the hips.
Wow, yeah. That is unheard of.
I have one patient who's 65 who's become a national level badminton champion after hip replacement. So is knee replacement painful and can you play sports after that? No. But a hip replacement can actually give you a new lease of life. That's because the musculature around the hip is so much that it can actually it can offload the implant and give you a great life. The knees are subcutaneous joints, so they do require a little bit more of physiotherapy and work. So my friend, whoever's asked me this question, if you're scared of getting a hip replacement done, don't be. With the implants that we have and with the advent of robotics now in hip replacement, people are doing really well.
I'm sure that's a very reassuring answer for them to hear. We have another question. They say, my mom, age 82 years, has been advised knee replacement surgery. She has refused the procedure but suffers from severe pain as it is bone on bone friction. Is there
Right.
any
So
other
for such
option for
patient,
her, please?
radio frequency ablation, definitely.
Okay, we have a few more questions coming in. Give me a second. Okay, sorry, I'm just having a little bit of trouble. Okay, so I'm curious, what happens if non-surgical options don't work? Is the next obvious answer knee replacement surgery?
Well, the answer is yes, knee replacement surgery, because that means that we've tried everything.
Hmm.
It hasn't worked for you. You're still in pain. It's still affecting your day-to-day activities. It's still affecting you mentally. So yes, at that point in time, a knee replacement is a very, very rewarding surgery because the kind of pain, what you need to understand about a knee replacement is we essentially are changing the lining of the joint.
Hmm.
When we change the lining and the bones stop rubbing against each other, the pain that you had because of arthritis immediately goes away.
Hmm.
The pain that you actually have is the surgical pain, which of course in a month and a half goes away. And with the advent of robotics, which we do, we have seen within 3 weeks, patients walking. In fact, today we had a patient who after 2 weeks was walking without a walker. And she's just
Oh.
saying, Doc, I just have a little bit, she's having 100 degrees of flexion. She's asking me when she can sit on the floor, right? So there has been great progress in the science and the art of knee replacement. I would rather call it an art because every patient is different. And, it all depends, comes to the patient. If you really want to live a life in pain, that is your choice. But if you don't want to live a life in pain, we have options
Hmm.
and great options. And of course, I'm not sure if people have heard about the chondro filler, which is coming in from Germany, which is under testing, which is known to or supposed to prevent knee replacement altogether. And if that works, then it's going to be a game changer.
Hmm. Okay, Doctor, we have two more questions. I think those are the last two questions we'll take for tonight. Uh,
Yeah.
Someone is asking, are these treatments suitable for someone with diabetes, high BP, or obesity?
See, the stem cell injection, the only contraindication of a stem cell injection is rheumatoid arthritis.
Hmm.
Because I'll tell you why. A rheumatoid arthritic patient has inflammation in their joint, and these injections work via inflammation. So if
Hmm.
you already have inflammation and you're causing more inflammation, it worsens your joint.
Hmm.
There is no contraindication to a diabetic patient, to a hypertensive patient. It is not because it's a local procedure. It is done under local anesthesia, and you give an antibiotic coverage for 3 days to prevent it. And we do it in a very sterile manner,
Hmm.
right? So, if you ask me, is there a contraindication? No, absolutely not. We've given it for a lot of people and most of the people who age usually end up having some sort of, hypertension or diabetes or thyroid issues. So,
Hmm.
that would ideally mean that you cannot give it for anyone.
Definitely. Okay, I think the last question for tonight is, does hypothyroidism affect arthritis?
Yes, because simple focus, hypothyroidism causes increase in weight and also a decrease in bone density.
Okay.
When that happens, your weight is not taken up completely by the bone, so it gets distributed between the other structures, one of them being the cartilage. When it starts affecting the cartilage, it causes arthritis.
Okay, I think we've covered all questions that have come in, and I think all of our audience has a lot of clarity. But before I go away, I have also heard that you've done some great work with a lot of sports people. So we would love to know about your sports medicine specialty and anything that you'd like to share there.
See, I am an athlete myself. I was a football player for Karnataka for many years, and I my one of my first specializations was in sports medicine and then joint replacement. So I don't want to say what I've done. I'm really not. I don't like talking about what I've done. I would just want to say that people are becoming more and more active, which is a great thing. But with every action comes an equal and opposite reaction. So if you become more active, you're prone to more injuries.
Hmm.
So if you are a person who's just recently started an activity, or you want to lose weight, or you're really willing to become physically active, go for it. Hats off to you. But remember, do a good stretch or a warm up before your any activity, whether it's running, jogging, or just fast walking. Do a good cool down after the activity. Don't just immediately stop the activity and start moving. And if you're having a continuous joint stiffness, if you're having an instability in your knee or severe sharp pain, do meet your sports medicine physician, because you don't want it to land to a condition where you have early onset of arthritis, which is actually what we've started seeing in the last 10 years.
Hmm.
People have started becoming very active, which is great, but you need to take care of yourself at the same time.
Hmm.
It's like saying that if you rev a car at 100 at all times, which is not possible in Bangalore, of course,
Hmm.
but if you're living in a place where you can actually drive on 100 every time, there comes a time when you'll have to give it some rest.
Hmm.
So if you are for loading your joints, whether it's your shoulder joint or your knee joint or a hip joint, through whatever activity, whether badminton, running, or whatever, make sure you take good care of it. And if the problem is not getting sorted, meet your sports medicine physician, meet your orthopedic surgeon, have a discussion with them. Like I said, let them come up with a solution or let them diagnose you. Go do your research, come back, read about it, talk to us about it, and we are there to answer all your questions.
Okay, I think that's a great feeling to, end this webinar at. But I just one last question from my end to you, doctor. Is there any key takeaway you would want to give to our audience when it comes to dealing with arthritis?
Uh, um, uh, just one second, sorry. Yeah, sorry, just had one patient asking me a question right now. I think he's seeing the webinar, I'm not sure.
No worries.
You can ask the question. I just messaged him saying that you can ask the question on the webinar. Yeah. So yeah. The key takeaway is prevention is better than cure. Keep yourself happy, healthy. Keep yourself fit. Make sure that you take good care of yourself. Diet, nutrition, physical activity is a very important part. But if you do start having problems, don't ignore it. Don't feel that just because going to the doctor will suggest knee surgery. If somebody suggests something to you, you don't have to get it done. The prerogative that you have is to find out what the problem is. And it is your prerogative to take multiple opinions as well. Find out exactly what the issue is, read about it, do your research about it, and then come back and ask the right questions so that we can give you the right answers. Right? At the end of the day, if you do land up with knee osteoarthritis, which is grade 4, and you do require a knee replacement, sit with your doctor, have a discussion. What is going to be the recovery time? What is going to be the procedure? Spend about 30-35 minutes with them. And they should guide you through what is the procedure. And trust me, it's a very, very rewarding surgery because I can actually send you a video of one of my patients who started running after a knee replacement.
That
So
sounds
it's
uh, that sounds very reassuring, and I'm sure it has helped ease all of the fear that our audience has had. Audience members, I would love to encourage you to book your free appointment with Dr. Akshay. Not only has he answered all of our questions so well with so much patience, but he has also recently achieved excellence in orthopedics by Vijay Karnataka. Congratulations, doctor. So
yeah.
thank you so much for spending this time with us on a weekday. I'm sure you're very busy. And thank you so much to all the audience members. I have dropped in a custom link through which you can book your free appointment with Dr. Akshay. It will also be in the description of this video and in the WhatsApp group that you're part of. Thank you so much. Thank you
Well,
so much for
thank
joining
you
us.
so much. Thank you guys for coming and taking out your time. I'm sure you were busy and with your family. So I hope it helped everyone. And of course, if you'd like to meet us, you can. Sanya is going to be there. And thank you, Sanya. You've really held the session really well. And again, I apologize for having those in coming late. And doctor's life never ends.
No
Yeah.
worries. I'm sure our
Yeah.
audience understands. No worries. Thank you so much.
Thank you. Thank you all. Take care. Bye bye. Good night.